So in today's topic, we'll discuss diabetes mellitus, not from the textbook, okay? If anyone is joining late, please help them out with the topic name. Wednesday classes topics are not from the textbook. So diabetes is a condition that happens when your blood sugar levels, they stay high, okay? It uh, it develops when your pancreas does not make enough insulin, or it is making insulin, but your body isn't responding to it. Okay, so that's the reason why there are two different types of diabetes. Okay, so diabetes affects people of all ages. Most form of diabetes are chronic, lifelong. Okay, and they all are manageable. You can have a healthy life. You can lead a healthy life with diabetes, with medication and some lifestyle changes. So glucose or sugar, it mainly comes from carbohydrates in your food. Okay. Carbohydrates are broken down into glucose. It is your body's go-to source of energy. Okay. First, your body find it's very easy to break down glucose for energy requirements as compared to your lipids or fat levels, etc. Okay. Your blood carries glucose to all of your body's cells to use for energy. Okay. When the glucose is in your bloodstream, it will need help of insulin to reach its final destination, that is the cells. Okay. And if insulin is not there, your glucose will not be able to enter into the cells. Okay. Insulin helps your body to make sure that your cells are opening the doors for glucose to enter, and in the mitochondria this energy production will take place. When glucose is in your bloodstream, it needs help of insulin to reach its final destination. And if your pancreas isn't making enough insulin or your body isn't using it properly, glucose builds up in your bloodstream, causing high blood sugar levels. And over time, having consistently high blood sugar levels, that leads to inflammation. Okay. If your blood glucose levels are not coming down, your body goes into a inflammatory response mode. And when your body stays in that inflammatory response mode, it is harmful. Okay, it is not healthy. You will get inflammatory diseases. When body stays in inflammation, that's how inflammatory diseases will start. Okay, it will cause heart damage, nerve damage, eye issues, neuropathy, retinopathy, okay, nephropathy. Different tissues of different organs will undergo damage because the blood glucose levels are high. It is not going down. So what are the different types of diabetes? Type 2 diabetes. With this type, your body does not make enough insulin, or your body's cells don't respond normally to insulin. This is the most common type of diabetes, and it affects adults usually. Okay. And children can also have it. That is type 2 diabetes, and that is the most common type of diabetes. Okay. Insulin is produced, but your body is resisting its response to insulin. Okay. With pre-diabetes, this is a stage before type 2 diabetes. Your blood glucose levels are higher than normal, but not high enough to be officially diagnosed with type 2 diabetes. Okay, it's like borderline. Okay, here, if you make some lifestyle changes and you try to control your blood sugar levels, you will not get diabetes. Okay, so that is the pre-diabetes stage. Then type 1 diabetes. This is a type of autoimmune disease in which your immunity system attacks and it will destroy the insulin producing cells, and there will be no insulin production. Okay. It is usually autoimmune. Okay. Your own immunity is attacking. So it's an autoimmune kind of a diabetes. And up to 10% of the people who have diabetes, they have type 1 diabetes. And usually it is diagnosed in children, young adults. Okay. But it can develop at any age. It is also called as juvenile diabetes. Okay. Your pancreas have these two types of cells. Okay. In the islets of Langerhans, that's the area, that's a tissue in your pancreas. Okay. This islets of Langerhans is made up of alpha cells and beta cells. Beta cells produce insulin, alpha cells produce glucagon. Okay. Then you have gestational diabetes. It happens during pregnancy. Okay. So this type of diabetes develop in people only during their pregnancy. And when they are not in their pregnancy, when the child has been born, it will go away. The gestational diabetes will go away after pregnancy. But there is always a risk on these women who had gestational diabetes that they will have type 2 diabetes sooner or later in their life. Okay. Just like PIH, pregnancy induced hypertension. Women who have PIH, pregnancy-induced hypertension, they will also get high BP issues sooner or later in life. Okay, that is the same scenario for gestational diabetes as well. And how common is diabetes? Is the most common form. Type 2 is the most common. 90 to 95% of all diabetes throughout the world, it's type 2 diabetes. Okay. About 537 million adults across the world are diabetic. And this number is on the rise. Okay. By 2030, it will be around 643 million. It's like a pandemic. Okay. And this will keep increasing. That is what it's been predicted. So what are the symptoms of diabetes? Increased thirst, that is polydipsia. Okay, these medical terminologies, just note it down. Okay, polydipsia, increased thirst, and dry mouth. Frequent urination. Okay, the more you drink fluids, the more you will urinate it out as well. So frequent urination. Polyuria. Okay, then fatigue, tiredness. Why? You are eating food, but the glucose from the food are not reaching the cells. So when the cells don't get energy, you will not have energy. So that is why you have fatigue. Blurred vision. Okay, that is your retina, eye tissues are getting affected by the inflammation. What inflammation? Inflammation caused by high blood glucose levels. In diabetes, your blood glucose levels are high. Okay, so that will cause inflammation. Then we have unexplained weight loss. Since energy from the glucose is not getting produced, Okay, body has to use some other means for energy, and the other mean is your fat. Okay, the body fat that you have, that will be used up for energy. So that leads to unexplained weight loss. You will lose, your body is using up fat for energy, and you will lose your body fat, and that's how your weight loss happens. Numbness or tingling sensation in your hands or feet, because your nerve system is getting damaged. Neuropathy, okay, it could be the start of neuropathy. Usually the numbness and tingling sensation is at the end of your toes, okay, the tip of your toes, the tip of your fingers. From these areas, the numbness and tingling sensation will start, and it will spread throughout your extremities. Okay. Slow healing of cuts or sores, any wound that you get, any cut that you get, it will heal very slowly, because blood has high blood sugar, and that delays your clotting. Okay, high blood sugar levels will delay blood clotting. Frequent skin or vaginal yeast infection, because the pH changes. Coming to the causes of diabetes, so far is it clear to all? The basics of diabetes, is it clear to all? So first cause is insulin resistance. Type 2 diabetes, okay, that usually starts with insulin resistance. Okay. Here, because of high blood glucose levels, high levels of insulin is also getting released into your bloodstream. Okay. And this insulin is responsible to knock the doors for the cells to open, so that it can take in glucose for energy purpose. Okay. But the cells are not responding to insulin, and they will not open up their pathways for glucose to enter. Okay. So your muscles, cells of your muscles will be tired. You will be tired. Okay. Uh, Even your fat muscles, fat cells, your liver cells, okay, they also don't respond to insulin. And insulin resistance are also comes also in varying degrees. Okay, mild, moderate to severe. Okay, depending on your lifestyle. Obesity, lack of physical activity, diet, hormonal imbalances, genetics. Okay, if you're taking certain medications, these all have an impact on you developing insulin resistance. Okay, how to prevent it? After your meals, lunch and dinner, just walk for around 15 minutes. That will make sure the cells respond to insulin. Okay, some form of physical activity after you have your big meals, that can help. Autoimmune diseases, type 1 diabetes, and latent autoimmune diabetes in adults. Okay, that is LADA, latent autoimmune diabetes in adults. That will happen when your immune system attacks the insulin producing cells in your pancreas. Okay, that is the beta cells in the islets of Langerhans in your pancreas. So that get attacked, it will stop producing insulin. So that leads to low to no insulin production, and that leads to diabetes. Then you have hormonal imbalances during pregnancy. The placenta also releases certain hormones that could lead to insulin resistance. Okay, and it's because of the hormones secreted by the pancreas, gestational diabetes can happen. Okay, so you may develop gestational diabetes if your pancreas cannot produce enough insulin. Okay, or to overcome insulin resistance. Other hormone-related conditions like acromegaly, Cushing syndrome, okay, that can also cause uh, type 2 diabetes. Cushing syndrome and all is a thyroid issue, okay. Then pancreatic damage, any physical damage to your pancreas, okay. Alcoholism, too much of alcohol consumption can also damage the pancreas. That can lead to diabetes, okay. Physical damage, any surgery, injury, any accident, any traumatic injury in which the pancreas got damaged, okay, that can impact your insulin making ability. And that becomes a type 3 diabetes because of injury. It is not because of your autoimmune disorder or because of insulin resistance. Then genetic mutation can cause MODY diabetes, okay, MODY. So here, certain links of your genetic programming, okay, certain mutation can take place there that could lead to diabetes, okay. MODY stands for maturity onset diabetes of the young. Maturity onset diabetes of the young. Okay, so this is also a hereditary form of diabetes. So here, any autosomal dominant gene should be disrupting and causing the mutation. It's not an autosomal recessive condition, it's an autosomal dominant condition. Any one parent, if it has this gene, okay, the child will also have this gene. Next, you have acute diabetes complications. Hyperosmolar hyperglycemic state. So here, this is the condition of your blood. Okay, since the blood sugar levels are very high. Okay, if it is over 600 mg per deciliter, that is high levels of blood sugar level, and that you have for a very long period. Okay, that will lead to severe dehydration, confusion. Okay, because the body is always in a state to bring equilibrium. Okay, so imagine a situation in which your blood glucose levels are so high that your body is constantly trying to dump all the glucose through your kidneys out of the body. Okay, so as much as possible, for the kidneys to take glucose out of the body, urine is required, and for urine, water is required. Okay, so all the hydration from your body will be pulled out. Okay, all the water from your body will be pulled out just for the sake of dumping this additional glucose, high levels of glucose out of your body. Okay, that leads to severe dehydration. That is called as the hyperosmolar hyperglycemic state. Then we have diabetes related ketoacidosis. So this complication, it mainly affects people who have type 1 diabetes. Okay, your body is not able to use glucose for energy, so it will break down fat, just like how you are on a keto diet. Okay, there is no glucose, so fat will be used up. But when fat is being broken down, it is broken down into ketones. When adipose tissue that has fat in your body, when that is getting broken down, it will lead to ketones. Okay, and ketones will take over your blood. Your blood becomes acidic because ketones are acidic in nature. Ketones go into your liver. Ketones go into your brain. Okay, wherever which the organs are this acidic ketone rich blood will go there. Okay, that gives you a fruity kind of a breath. Okay, in the when ketones go into the lung, it gives you a fruity breath. Okay, and this causes labored breathing, vomiting, loss of consciousness, and it requires immediate medical treatment in situation of ketoacidosis. Because when the ketone bodies they go and when they settle down in your brain tissue, that is a medical emergency situation. And that is the reason when you are on a ketone diet, at least 5 to 10% should come from energy, should come from glucose or carbohydrates. Otherwise, it will lead to breathing issues, vomiting, conscious loss of consciousness. Okay, it will lead to a medical emergency when you follow keto diet as well. Okay, the conditions are same. What happens in diabetes? It's the same ketosis that is happening in your body when you are on a keto diet. Severely low blood sugar levels. Okay, when you are getting treatment for diabetes, when you are on insulin or other medications, okay, to treat high blood sugar levels, sometimes it can push your body to the other extreme, okay, of severely low blood sugar levels, hypoglycemia. Okay, when your blood sugar levels drops below the range that's healthy, and it usually affects the people who have diabetes, who use insulin. Okay, among insulin users, it is common as compared to metformin users or any anti-diabetic drug users. And what happens in case of hypoglycemia? Blurred vision, clumsiness, disorientation, seizures. Okay, it requires treatment, and immediately you have to give this person glucose biscuit, something sweet. Okay, glucose water has to be given so that you are bringing up the blood glucose level. So medical intervention, immediate medical intervention is required. Am I audible to all? Then long-term diabetes complications. Cardiovascular complications and blood vessel complications are the most common type. Okay, heart issues. And if at all there is any heart issue like high blood sugar, high blood pressure, etc., automatically kidney issues will also follow. Okay, coronary artery disease, heart attack, stroke, atherosclerosis. These are the disease conditions which are commonly associated with diabetes. Having diabetes increases your risk of developing these disease conditions. Then other complications, nerve damage, which usually causes numbness, tingling, sensations, and even pain. Okay, that is called neuropathy. Okay, it starts with numbness and tingling sensation, and when it progresses, it becomes painful. Nephropathy, damage to your kidneys. Okay, it will first affect your glomerular filtration rate, and then it will lead to kidney failure. And you may require dialysis treatment as well or kidney transplantation. Retinopathy, which can lead to blindness. eye tissue, especially the retina, will get damaged and it will lead to blindness. Starts with blurred vision, blurring of vision. Okay. Then diabetes related food conditions, any wound, cut, or sore in your feet will not heal properly. First of all, the feet, the blood flow is also low. Okay. Neuropathy has affected. Okay. So these all factors will lead to uh, wound that is not healing. Okay. So that is diabetic foot. Skin infections, again, cut, sores, wounds will not heal properly because of high blood glucose levels. Okay. And if there is delay in healing, there is a risk of infections. Then you have amputations. In case of diabetic foot, if it progresses, if it spreads upwards towards your extremities, okay, amputation will be required, okay, to save the remaining area of the leg, cutting off parts of either the feet or below the knee, okay, these all are amputations that is required. Sexual dysfunction due to nerve damage and blood vessel damage, erectile dysfunction in men, vaginal dryness in women. Okay. So in both these cases, sexual dysfunction is seen. Then gastroparesis, issues with your GI system. Okay. Not having a good motility, stomach muscles are not emptying properly, they are not contracting properly. So definitely it will affect, it could lead to constipation, okay, lack of gastric motility, that is gastroparesis. Loss of hearing because of nerve damage in your ears. Oral health issues, cavities, okay, bad breath, fruity breath. Because of the acidity of ketones, oral health may also go down. So diagnosis and tests which can confirm diabetes. First is your fasting blood sugar test, fasting blood glucose test. You are not supposed to eat anything for at least 8 to 12 hours. Okay. After 9 p.m., don't eat anything. And by 7 p.m., get the fasting blood glucose test done. Okay. So that is what we follow in India. You have to fast. Your body should be in a fasting state. And that blood sugar is required because this will allow uh, the tester to see what is the baseline blood sugar level. Okay. If your fasting blood sugar is above 100, above 120, which means that you have high blood glucose level, that you are diabetic. Okay. Even when you're fasting, the blood sugar levels are high, it means you're diabetic. A fasting blood sugar level below 100, okay, between 80 to 100 is considered normal. That is the range, okay. Then you have random blood glucose level. Randomly, any time of the day, blood glucose level is taken. And if um, it is between 70 to 99 mg per deciliter, you are considered to be normal. Most of the time, it will be around 125 as well. That is also normal. Then HbA1c test. So in this test, the glycated hemoglobin test. Okay, that is another name for it. Hemoglobin, which runs in your blood for about 120 days, they get glycated. Okay, they have the data of how your blood glucose levels are from the past 120 days. Okay, so that is HbA1c test. So here, if your HbA1c level is below 5.7, you are considered non-diabetic. Okay. If your levels are in the range of 5.7 to 6.4, pre-diabetic. And if it is above 6.4 or above 7 percentage, you are diabetic. Okay. That is HbA1c test is considered the most accurate test for confirming diabetes without errors. Okay. It's kind of your average blood glucose levels over the past 2 to 3 months, how you have been doing. Okay. In terms of your blood glucose levels that you will get in HbA1c test. To screen for or to diagnose gestational diabetes, oral glucose tolerance test is also taken. Okay. In which at a controlled time, you are given glucose water. Okay. And your blood glucose level with glucometer, your blood glucose levels are monitored. It is put on graph. Okay, that is oral glucose tolerance test. Right now, if it is, for example, let's say it's 3 p.m. Okay, 3 p.m. You are fasted and it is 3 p.m. and your blood sample is taken. So your baseline blood sample they have. Then they will give you some glucose water to drink, and then half an hour later, again your blood sample will be taken. Okay, it will be checked. After 1 hour, again they will take. It's like this for 3 hours. Your blood samples will be collected, and it will be it will be marked on the graph, and that slope will determine. Okay, if the slope is very high, it means you have a high blood glucose level. If the slope is increasing very slowly, okay, it means your blood glucose levels are controlled. So these are the indices. We can take a screenshot of it. Fasting blood glucose level in range, pre-diabetic range and in diabetic range. Fasting blood sugar should be less than 100. 100 to 120, okay, that is also considered pre-diabetic, but not diabetic yet. But if it is more than 120, fasting, it's diabetes. Okay. Random blood glucose levels, if it is more than 200 any time of the day, it's diabetic. HbA1c, as I mentioned earlier, 6.4 or higher, diabetic. Below that, you're non-diabetic. Coming to the management and treatment, blood sugar monitoring is important to determine how well your current treatment plan is. Okay. On a regular basis, if you are pre-diabetic or diabetic, on a regular basis, blood sugar monitoring should be done. Okay. Only then you can understand if the medicines that you're taking to control your diabetes, is it working or not. Okay. It gives you information on how to manage your diabetes on a daily basis. Okay. And also on an hourly basis, how to manage your diabetes. Glucometer is also used. Finger stick method is also used, which anyone can use on their own. You will not require a laboratory visit every now and then. Okay. Oral diabetes medicines, medications, oral pills that is taken. Metformin is the most common one. So it will help to manage your blood glucose level in people who have type 2 diabetes mainly, or who are at a pre-diabetic stage. Okay, for them also it is given. And also women who have gestational diabetes, they may also require oral medication. Insulin, people with type 1 diabetes, they require, they need to inject synthetic insulin to live and even manage diabetes. And people with type 2 diabetes, only when if it is recommended, if the diabetic levels are too high, which cannot be controlled with medicines, only then insulin is required. Okay. Type 1 diabetes, definitely they require insulin because their pancreas don't produce insulin. And there are different speeds of insulin, long acting, short acting. Okay, there are different rapid acting insulin. There are different types of insulin based on how soon it will affect your blood glucose levels. Okay. Injectable insulin is also available, insulin pens, insulin pump, and inhaled insulin is also available. Okay. Diet, meal planning, choose a healthy diet for you. These are the key aspects of diabetes management. If you take insulin, counting carbs in food and drinks you consume is a large part of management because you have to control your carbohydrate intake. Okay. The portion control also has to be done. And the type of carbohydrates, no simple carbohydrates, only complex carbohydrates should be taken. Okay. The amount of carbs that you eat, it determines how much insulin you will need. So healthy eating habits can also help you manage your weight and reduce your risk for heart diseases as well. Exercise, physical activity, it increases the insulin sensitivity. Okay. So if you are in an insulin resistant stage, add more physical activity in your schedule. Regular exercise is important part of management of all people who have diabetes. Prevention strategies. You cannot prevent autoimmune forms of diabetes. Okay. It happens on its own. You cannot control it. Okay. But type 2 diabetes, if you have the risk of it, based on your family history, if you have the risk of it, that can be controlled. You can lower your risk of developing type 2 diabetes and gestational diabetes as well. So how can you do it? Eat healthy diet. Mediterranean diet can work, but for Indians, you will not feel comfortable with Mediterranean diet because it has a lot of raw vegetables, raw green leafy vegetables and all. Okay, usually Indians have a plant-based diet, but it is cooked form of vegetables. Okay, the Mediterranean diet, they are also predominantly plant-based, but a lot of raw veggies. Okay, get physically active. Aim for at least 30 minutes of physical activity a day, 5 days a week, and work to achieve a weight that is healthy for you. There is no ideal weight range. Okay, based on your height, what weight is required that you have to achieve. Pre-workout food has to be given. Pre-workout snacks has to be given. Manage your stress levels. High levels of stress can cause a similar kind of inflammation that can damage your pancreatic cells. Limit your alcohol intake as well. Get good, adequate, sound sleep of at least 7 to 9 hours. And if you have any sleeping disorders, get a treatment for that, insomnia and all. Quit smoking. Any type of drug abuse, that is a habit, it has to be stopped. Take medications as directed by your healthcare providers to manage the existing risk factors of heart disease. So that's all for diabetes management. If you have any queries, please mention in the chat box.